Hey everybody, Professor Long here, doing Professor Long's lectures in anatomy and physiology. As you guys know, I'm doing these videos for my students, so please, if you're in my class, learn what I cover. If you're not in my class, learn all the structures that your instructors ask you to cover, but hopefully these videos at least help set the foundation. If they do, please hit like and subscribe so that I can get some feedback and do more videos. Now, we've been covering the muscles of the body. We did the muscles of the head, the muscles of the thoracic cage, or the breastplate. I'm going to do the muscles of the posterior thorax, or the back muscles of your back. In order to see those, again, I like to draw this out and then I'll show them to you on the model in another video. So I'm going to put some reference points here. This would be the back of your skull. This is the occipital bone of the skull. I'm not going to draw the vertebrae as so much put the spinous processes of a bunch of our vertebrae here. So these would represent the spinous processes of our vertebrae. And then down here we would have our hips. Okay. Now there's a bone that sits over here, something like this. It's not the best drawing of it, but our scapula would sit there on both sides, like this. Okay. Probably not going to be perfectly symmetrical, but you get the idea. You can see the spine of the scapula, the acromion process, the glenoid fossa. And then sitting over here would be the head of the humerus, and the humerus bone would be hanging down like this, and the head of the humerus would be here, something like that. Just points of reference. Now, when we look at our models, you have to remember that on our larger mannequins, the superficial muscles are left on the right side of the mannequin, the deeper muscles are remaining on the left side. They've cut and reflected the superficial muscles. One of the muscles that covers most of our back is this large muscle that goes from the occipital bone down to the spine of the scapula and then down the back this way. And the muscle fibers do this. And if I had the rest of this muscle here, it would be outlined like this. That large muscle is trapezoidal in shape. And so this muscle is referred to as the trapezius muscle. You've all heard of traps. That's where they get their name from. The traps muscles, when you're doing trap exercises, are the trapezius muscle. They help lift our shoulders, and they're involved in anything overhead. They get involved in a lot of movement. They also restore a lot of strain and stress as we stay upright. So when people rub our trapezius muscles, it feels great. Now there's another large muscle that extends underneath the trapezius, and you'll see a lot of it coming down to the lower back here. And it actually inserts on the posterior part of the humerus. And this muscle is called the latissimus dorsi. For me, kind of meaning side and back, lateral and dorsal. Latissimus dorsi. It's a very large, powerful muscle on our back. So anytime you're doing this, doing pull-ups or pulling down, they call it the lat pull down, latissimus, or any kind of back muscle exercises. These muscles cover most of our back. On this side, we've cut and reflected the trapezius and latissimus so we can see some of the deeper muscles. One of the muscles extends from the inferior border of the scapula, the inferior and medial border of the scapula, over to the spinous processes. And there would be another one over here, but it's been removed. This muscle is called the rhomboideus major. Oops, I combined my A and my J. It's called the rhomboideus major. And there's actually another little strip up here which would be called the rhomboideus minor. And we don't see them on this side because they're buried beneath the trapezius. And then there's several muscles and ligaments and tendons that make up what we call the rotator cuff. It makes a cuff around the muscles that help us rotate our shoulder. One of those muscles sits superior to the spinous process and attaches over here laterally to the humerus muscle. And since it's superior to the spine, that muscle is called the supraspinatus muscle. Supraspinatus. It would be over here, but it's covered by the trapezius. There's another muscle that sits inferior to the spine of the scapula, covers most of the scapula, and attaches over here. And this one is called the infraspinatus muscle. The infraspinatus, okay? There's a couple of muscles that attach right here underneath and go over here called the teres. There's a teres major and a teres minor. I'm not going to put them on my drawing, but we will see them on the model. And they would be right here, the teres major and teres minor. There's another muscle that sits underneath. If I could flip the scapula over, it's running on the inferior margin of the scapula, or I should say the deeper surface of the scapula, and that is called the subscapularis muscle. Subscapularis, below the scapula. And again, we're not going to see that here. But then there's another large muscle that covers all of this, or at least a large part of this, and inserts over here, and that one would be called the deltoid muscle. So this gives you a pretty good idea of a lot of the muscles of the posterior of the body. The trapezius, the latissimus dorsi. If I peel those off, I would have a supraspinatus and infraspinatus, the teres major and minor, the subscapularis, and the deltoid muscle. Okay? So I hope that this was helpful. I hope you learned something. I'm going to show these to you on the models, and I hope you had as much fun as I did. See you in the next video. By the way, I just realized that some of this was not on the view, so there you go. There's a good view. Hopefully you guys can take a picture of that or stop the video and study it, but now you should be able to make out all the muscles.